Make my face fuzzy.
Pixelize them.
What are you all talking about?
Our question.
Read your question.
How has personal narratives been used successfully for advocacy and change? We were talking about just in light of like Ruby's experience with the doctors, and so we were talking about personal narratives, how our personal narratives are changing. Yeah. How short
Changing
staff
what?
Changing
Understaffing.
the status quo.
You're being really good.
Medical system, the medical institution.
About medical provider. Because that's how you can say like doctors, nurses, all that.
What we were trying to get at was how, with Ruby's incident specifically, how they didn't disclose all the information that they could have disclosed prior to her making a decision with her mother, and how a lot of times that happens in the medical field where they're not completely disclosing everything that like, oh, okay, well, by the way, she did have an infection in her lungs, or oh, by the way, this is your right as the family to do whatever it is. And so how do we get that clarity into practice, and maybe even more of a doctors to me, and I think this goes for a lot of people, but for myself, they have, they just kind of get this brazen hardcore out, and not all of them, but it's like they're so used to the sick person, so used to the dying process that it's just another day in the life of the doctor versus these are sick people who are dying, these are their families that are losing a loved one. So I think that's kind of what we're basing, we're trying to come to a question based on that conversation.
Sorry for me, because I'm a medical.
You're really good at doing the cards. So how about inform the grieving family of their laws and rights?
What did you say?
Inform the grieving
No, I mean, what did you
family.
say before that?
Oh, your cards that you did for the
Oh, business cards. I was like, what is she talking about?
I don't know if I told you guys about this, at the health conference that I went to, one thing that they presented, like the first thing was this form that people should take in, that you have to get it off this state website that was going to go onto it. But it's just like, you write down the objectives for the visit for your doctor, you bring it in, this piece of paper to give to them at the beginning of the visit. These are my 3 objectives. I'd like them to be addressed.
You know why? And I don't remember who did this research, but it was on the news that, and this is another bad thing, your doctor listens to the first 15 seconds of you talking. The first 15 seconds. Now, I think it's different for ARNPs, you know, but this is what that came out as a statistic.
That doesn't surprise me for some reason.
15 seconds?
How would they measure days?
I could look it up, but I guess they would, you know, how much did you tell your doctor? What did they hear you say? Because I always write stuff down when I go into the doctor. I'm like, oh yeah, by the way, come in for 1 thing, 10.
So if I can feedback a little. So you have a question regarding your events right now regarding full disclosure by physicians or by the medical staff of the state of well-being or illness of patients. So that's one question. Is that accurate?
Yeah.
So how do you evoke full disclosure? Or how do you engage a physician or this medical staff in elaboration? So those are the 2 words that come to mind, because part of what you're saying is that there's not sufficient elaboration of what is going on for a family to understand what their choices are. Is that right?
If they don't know the right questions to ask, because they're uninformed, then they're not.
Well,
That's a whole other question.
Right, and so that brings up another issue because being like you and myself who've been in the medical field, we know, have an idea of what kind of questions to ask. But what about the person who has no idea and they bring their kid in, this kid's diagnosed with, for instance, PRE, which is this brain stem. So they're under the impression that the kid is dying. They need a big operation. She can't do anything anymore. And then you get in there with somebody like me who went in to be their advocate, and no, she has some serious psychological disorders, or issues regarding her family life, and the Kiara is going to be something that's there all of her life. But so how do you get those questions from either, it's not even the doctor so much as it is the family who absolutely is uninformed and has no idea how
As
to
an
act.
advocate, like you just said you were.
Right, but not everybody has
Of
advocates.
course.
So that's a, you know,
So
how do
the
you
big
inform them?
question, once again though becomes, how do you improve, so this is the biggest question, how do you improve the quality of communication between medical staff and patients, including families? That's the big question. And then you can have sort of sub areas that you're talking about is, well, one of the questions you have is, how well does advocacy serve to generate greater elaboration of families' problems and issues? How does advocacy serve to improve the quality of communication between physicians or between medical staff and patients?
Say that one more time.
How does advocacy serve, or not serve,
The double.
the medical staff? How does it serve to improve communication between medical staff and patients? Well, you have an initial question, which is, does advocacy serve? If so, how, right? So we might as well just go to, how does it serve? How does it support or not support?
Yeah.
That becomes your question. So those are sort of that's sort of two of the sub areas. So then there's a whole other question that you have, which is, how do you improve doctors' disclosures? How do you improve the quality and extent of doctors' disclosures to patients and families? Are there training programs that exist? Is there something that happens after a certain point in time in their development where they stop listening? You know, where is the point? And that's one of the questions you're asking. Is there a point along the continuum of development of a medical staff person's career where they shift or change in their focus around communication? So to make that a smaller question and more manageable, you could look at and compare, for example, early medical staff, and I'm using this word medical staff because I'm not sure who you're talking about. And so if you talk about nurses, and you can say, well, we'll look at focus on nursing staff. If you talk about physicians, you could say physicians. But you could look at a longitudinal or cohort study where you say, we're going to start with a cohort just out of medical school. We're going to start with folks who've been out of medical school for 10 years, and we're going to compare the quality of communication they have with their patients. Is there greater disclosure, less disclosure? Do these physicians spend more time or less time? Is there some qualitative difference in how these two cohorts talk to their patients? And then you say, and is there some pathway of development that they follow where things shift? And if so, what is it that shifts? How does it shift? So that's a whole research design. You can just say, let's borrow that one. But you'd have to elaborate more on it. So, but I mean, that's one way of looking at this question, so that you can figure out what there is in terms of the training process, or what there is that happens to physicians, we'll say physicians, in terms of the quality of communication between patients and themselves. Is there a point where it decreases? Is there a point where it increases? Is there a point where there's greater elaboration? Is there a point where their attention drops off? Is there a point where something happens?
I would include legality, because it goes two ways. When they're younger, they might think they can't say as much because they don't know the laws, or they might say more because they know the law. You know.
Yeah. Well, see, and that's exactly it. I mean, that's another sub-area question. So a sub-area question would be, how does the legal process and knowledge of legal systems impact physician communication to patients?
Like, do they have to disclose everything?
Yeah.
Do they have to? I know that as like a lab person or a lower person, you cannot disclose, oh yeah, the person's blood results were this. You can't tell their family that, even though they might need to know.
And that's a whole other question. Do disclosure laws impact the quality of communication between patients and doctors, or patients and medical staff? If so, how do they impact? So here's a whole series of questions that I hope are serving you. I hope this